Throughout the pandemic, vaccine clinics have been a key part of the city's COVID-19 response. However, in mid-December, all 4 city-run clinics are being shut down, and it comes at a time when people are being encouraged to get COVID boosters. Whether it's this clinic in Scarborough or here at the North York Civic Centre and elsewhere, Toronto's Associate Medical Officer of Health, Dr. Vanita Dubé, says one thing is clear.
The response has been tremendous, and certainly our clinics have been fully booked for many, many weeks and have had a steady flow of people getting their COVID and flu vaccines.
And one's needed for students in schools.
Hepatitis B, human papillomavirus, and meningococcal.
In fact, Dubé says staff are trying to catch up on youth vaccinations not administered because of the pandemic response.
About 250,000 students, so that's almost 70% of students, according to Toronto Public Health records, are missing 1 or more doses of vaccines. They didn't get the vaccine because of the pandemic, or maybe they got it but they didn't report it to us.
To protect them against serious conditions such as
measles, mumps, rubella, diphtheria, tetanus, polio, pertussis, varicella.
But now Dubé says making headway will become more complicated with clinics closing on December 13th. Provincial funding runs out at the end of the year. Staff are looking for $3.8 million to address gaps for youth vaccinations.
We'll continue to provide catch-up opportunities, notifications to parents as we can with some of that base funding. But because we are in a bigger deficit than in usual years, we just want to be able to address that as well.
A lot of people trust public health. They will go to a public health clinic and talk to the public health nurse and ask their questions and make sure that they feel confident that they are making the right decisions.
Ontario NDP health critic Franz Jelena is calling for more public health funding, saying clinics are vital for families.
They have a lot of catching up to do with school-age children, but they don't have the resources to do it. They are asking for a few $1 million so that they can make sure that school-age kids get the vaccinations they need.
CityNews asked Health Minister Sylvia Jones's office for comment about the end of funding for Toronto's clinics. A spokesperson didn't directly answer the question. Instead, they point to a 1% increase in funding in 2024 and extra money given in recent years for COVID response. Meanwhile, Dubé says public health staff hope the extra money will come. People can still get COVID boosters at pharmacies, but Dubé says the provincially funded clinics were helpful.
But we do have to recognize that there were some trade-offs and in public health, in healthcare, and so we do actually need to be able to address those.
In Toronto, Nick Westoll, City News.